Hi, I'm Dr. Stephanie Burns. Thank you so much for tuning in to this program about advocating now Blue Cross Blue Shield of Michigan's upcoming change to PPOs in terms of private practice payment for graduate mental health program faculty. My PhD is in counselor education and supervision, but certainly I've written and created all of this for all of us, whether you're in the field of counseling, social work, psychology, or a marriage, couple, and family. Um, this is for all of us. I stand in solidarity with all of our professions. And if you've seen my video, Advocate Now, Blue Cross Blue Shield of Michigan for PPO current subscribers, um, what will come next will be a repeat of that. However, so if you haven't listened to that video, I would encourage you to listen to what I have to say in the immediate subsequent uh, presentation that'll happen, because you need to understand kind of what's going on, where the change is happening, and especially um, the idea that there are some very different tracks that Blue Cross Blue Shield of Michigan could take. And them not doing this is incredibly detrimental, and it doesn't have to occur this way. There are other options, so it's really noteworthy what they're choosing to do. So if you haven't seen my video that I created, um, that was for Michigan Blue Cross Blue Shield PPO members, then stay tuned, don't skip forward. If you happen to have already watched that video, you know, at the end of that video, I said for folks who actually have PPO insurance, what they should do to advocate. If you already listened to that video, you can go ahead and skip to the end now, where you see the slide, 6 things you must do, because for us as graduate mental health program faculty, there are different things that we should do, that are separate from what the PPO subscribers can do. And so I hope that this information will be incredibly helpful to you as you help yourself, current students, and our interns and practicum students and limited licensed professional counselors, and our fully licensed individuals who are supervising our interns and our limited license graduates. We want to be able to help them the best that we can. So let's first clarify who's actually impacted right now. Blue Cross Blue Shield in Michigan has 2 different tracks. We need to distinguish the HMO side from the PPO side. And the Blue Care Network in Michigan is Blue Cross Blue Shield's HMO. And they historically have not covered services when treatment is provided by counselors, social workers, marriage and family therapists, and psychologists who have graduated and are working to become independently licensed in their profession. The folks who are impacted are those Blue Cross Blue Shield of Michigan members where they've got the PPO plan, the preferred provider option plan. And historically, the PPO plan has covered services when treatment is provided by counselors, social workers, marriage and family therapists, and psychologists who have completed their graduation requirements, and they're now working to gain that independent licensure. So, you know, just to clarify, right now the change is occurring with Blue Cross Blue Shield of Michigan, the PPO customers. So let's talk about the difference between a PPO plan and an HMO plan. And if you're a Blue Cross Blue Shield member in Michigan, you really need to look at your insurance card to see if you're on the PPO plan or the HMO plan. But there's reasons why employers offer the various plans to their employees, and there's also reasons why then employees pick one plan over the other. So for the HMO plans, you've got to really go through a primary care physician to get any kind of treatment. And that primary care physician, you're going to have to go through them to see a specialist. HMO plans, there's no out-of-network coverage. HMO plans, there's extremely limited providers that you're allowed to see. But for that, your monthly premiums are a lot lower, your deductibles are lower. Um, Administrative complexity is lower because everything's got to go through that HMO primary care physician. The care coordination is then highly coordinated. Um, Again, for specialist access, you've got to get the referral from the PCP, and it saves the member, the individual choosing the HMO plan, a lot of money. It can also, save money for employers as well. But the alternative to that, and many individuals in Michigan choose the preferred provider option, um, because they don't have to go through their primary care physician to get treatment. Um, they don't need a specialist referral from the primary care physician. Out of network coverage, you've got that option. And what that leads to is a lot more providers that you have to choose from. Now you pay for that because your monthly premiums are higher and your deductibles are higher. So you're paying for all of this. There's more administrative complexity because you don't have everything going through one primary care physician, and therefore the care coordination is less structured, but you have direct access to specialists and you've got a ton of flexibility. So you and your employer, if they are offering you the PPO plan, or if you had that option, um, in another way, you've paid a good amount of money, and that's part of the contract between what Blue Cross Blue Shield of Michigan promised you as part of the PPO and what you've paid for. Okay, so what exactly has changed? Well, in very early June of 2026, suddenly Blue Cross Blue Shield of Michigan announced that they would no longer cover services for the PPO plan when treatment is provided by counselors, social workers, marriage family therapists, and psychologists who are interns, meaning they're a part of it's a part of their graduate program in all of these professions to begin to have contact and directly work with clients, as well as individuals who have completely graduated and they're working towards independent licensure. That was done via something called incident to billing in private practice settings. Um, and for those of you who don't kind of understand how this all works, individuals who are either interns or have graduated and are working towards their independent licensure, they must accrue hours under supervision so that they can become independently licensed. So what's been taken away is the idea that interns and individuals who have graduated and working towards independent licensure will no longer be able to be treatment providers through Blue Cross Blue Shield of Michigan's PPO system. So I don't want to bore you with too many details, but in all of these mental health professions, so the counselors, the marriage, couple, family therapists, the social workers, the psychologists, when you've got an individual who's in their graduate program or they've graduated and they're working towards that independent licensure, their supervisor not only provides guidance to that supervisee, but the supervisor also takes on legal and ethical responsibilities for the patient that the supervisee is seeing. So there's a direct connection between the supervisor and the patient through the supervisee. And so, as such, it's been common practice for the supervisor to bill for the counseling services provided to the patient by the mental health practitioner working towards their independent licensure. And historically, this has occurred through Blue Cross Blue Shield of Michigan, the PPO side, via Incident to billing. So why exactly does Blue Cross Blue Shield claim that they're doing this? Well, they say, one, it's to strengthen their ability to identify rendering providers. Two, it's to improve oversight of quality of care. And three, to ensure reimbursement is appropriately aligned with provider licensure and participation status with Blue Cross and BCN. And remember that BCN is going to be the HMO option for Blue Cross Blue Shield in Michigan. The problem is, and the reality is that Blue Cross Blue Shield of Michigan is going to drastically reduce the mental health treatment providers in Michigan. And, Blue Cross Blue Shield has created this quote unquote problem. They could do several things and they would not have to reduce the number of mental health treatment providers in Michigan. So let's take these things point by point. One, Blue Cross Blue Shield claims it's to strengthen their ability to identify rendering providers. Well, currently, Blue Cross Blue Shield of Michigan is making the choice to not allow interns and limited licensed mental health practitioners to be paneled directly through Blue Cross Blue Shield of Michigan on the PPO plan side. Currently, all of those interns and those limited licensed mental health practitioners can apply for what's called an MPI number. And that is an identification number that links to one person directly. If Blue Cross Blue Shield of Michigan would allow these individuals to be directly paneled with Blue Cross Blue Shield of Michigan, then Blue Cross Blue Shield of Michigan would know exactly who was directly providing mental health treatment to the client. So there's a really easy solution there. So the reality is that Blue Cross Blue Shield of Michigan is willfully cutting off access to over 10,000 limited licensed mental health practitioners in Michigan. Okay, and let's look at point number 2 in their argument, that they want to improve oversight of quality of care. Blue Cross Blue Shield of Michigan claims that they'll do this by no longer allowing interns and individuals who have graduated and are working towards individual licensure to be reimbursed for doing that work in private practice settings. However, Blue Cross Blue Shield of Michigan does not determine how any of those professions, the counselors, marriage, couple, and family therapists, the social workers, and the psychologists, supervises its members working towards their independent licensure. That's set by the ethical codes for each of those professions, as well as Michigan state law rules and codes for all those professions, and then each one individually. So the reality is, even if Blue Cross Blue Shield of Michigan makes this change, all of the supervision requirements for a limited licensed professional counselor remain exactly the same if the supervisee works in a hospital or a private practice setting. So Blue Cross Blue Shield doesn't get to set these rules and regulations. So even if Blue Cross Blue Shield makes the change, the supervision requirements for each of those 4 professions, it doesn't change. What it does change is that there's far fewer places that you can get mental health treatment. And that for you means that you are going to have longer wait times to be treated, and you're going to have to travel a greater distance to receive that treatment if you're on Blue Cross Blue Shield of Michigan PPO plans. So ultimately, Blue Cross Blue Shield is willfully making it harder for rural and underserved populations to receive care, and for longer wait times for mental health treatment for everyone who's in a PPO plan in Michigan. Now let's deconstruct point number 3 in Blue Cross Blue Shield of Michigan's argument that they want to ensure reimbursement is appropriately aligned with provider licensure and participation status with Blue Cross, meaning the PPO and PCN. So once again, they keep aligning now their PPO being equitable with the HMO. So Blue Cross Blue Shield, what this comes down to is they don't want to pay the supervisor who has legal and ethical responsibilities for the patient that the supervisee is seeing. And that supervisor is also furthering the training of the supervisee through extensive consultation with the supervisee. So Blue Cross Blue Shield, they just want to pay the lowest rate possible that they can, and they want to make it harder for patients on the PPO plans to get a mental health counseling appointment. So here, Blue Cross Blue Shield is willfully cutting off the pipeline of licensed mental health practitioners that Michigan will have in the future. And Blue Cross Blue Shield is making some significantly flippant suggestions about how to negotiate all this. So they flippantly state that a private practice can convert to an outpatient psychiatric care facility if they want to bill for interns and graduates who are working towards independent licensure. However, per Blue Cross Blue Shield of Michigan's PPO requirements, in order for a private practice to convert to an OPCF, they must have on staff a board certified or board eligible psychologist or psychiatrist. And the problem is in 2026, we are currently in Michigan 880 psychiatrists short per NCHWA. And we've got many counties in Michigan that don't even have a psychiatrist in the entire county. So we don't have enough psychiatrists to go around to suddenly create more OPCFs. And then they also are required to have a psychologist on staff and a licensed master social worker on staff. And the problem is the majority of our private practices, whether it's psychiatry, counseling, psychology, counseling, social work, or marriage, couple, and family, many of them, you've just got a couple of providers, and it's not feasible for them to convert to this. And also to convert to this, that that facility, they've got to spend 3 to 4 years so that they can be fully accredited by one of these bodies that are listed here. And that's just not financially feasible. In addition, those facilities have to have emergency services available on a 24-hour basis. The idea that we can convert in the state of Michigan with these 4 professions, all the private practices, to this type of an organization is honestly just laughable. The challenges, even for the Michigan Department of Health and Human Services, they themselves have said that they've tried to take some of their facilities and convert them into this type of a facility through Blue Cross Blue Shield of Michigan. But the problem is that Blue Cross Blue Shield kept moving the goalpost. So if even MDHHS can't convert some of their existing facilities into an OPCF, there's absolutely no way that a private practice with one of these 4 professions can convert to this. And even if they attempt to, the number of years just to even ramp up to what's being suggested, much less to wait 3 to 4 years to be fully accredited by one of these organizations, it's an impossible track to take. Additionally, Blue Cross Blue Shield of Michigan flippantly states that all interns and individuals who have graduated and are working towards their independent licensure can just go work at a hospital, an outpatient psychiatric care facility, or through MDHHS, one of their community mental health facilities. But let's take a look at how many providers, limited license providers we have in Michigan. And this is just the folks who have graduated and hold a limited license. That's currently 7,296 social workers, 2,471 counselors, 489 psychologists, and 144 marriage and family therapists. That's 10,400 people total. And that's not even talking about the folks who are doing practicums and internships that are inside of their graduate programs. That's not even counting them. Okay. And while some of those folks are working in hospitals or outpatient psychiatric care facilities or, you know, community mental health facilities, in talking with MDHHS, they can't accommodate all of these people. So again, and this is actually the numbers that I'm quoting here. This is literally coming right now from the state of Michigan. Um, so this is also impossible. So what's really troubling here are there are several ways that Blue Cross Blue Shield of Michigan on the PPO side could solve the quote unquote problem that they themselves have created and not reduce the number of mental health treatment providers. I'm just going to list a couple. There's more. But first, as I've mentioned, interns and limited licensed mental health practitioners can apply for an MPI number. And if Blue Cross Blue Shield would allow them to be paneled directly with them, then they could be billing directly, and then Blue Cross Blue Shield of Michigan would know exactly who is providing the mental health treatment to the client. However, if Blue Cross Blue Shield of Michigan takes this route, then they're going to force supervisors to directly charge their supervisees for supervision. And because then, if Blue Cross Blue Shield of Michigan takes this track, they'll pay the limited licensed provider much less money for seeing a client, but then they're going to force the supervisors to directly charge supervisees for supervision. So you're already going to have that supervisee getting less money, and then they're going to have to pay out of pocket for their own supervision. So it'll be a difficult hardship for the supervisee. And the reality is, even through the Blue Cross Blue Shield Michigan system, if we look at it nationally, Illinois is taking a very different track. They are recognizing that there is a shortage of mental health treatment providers. And so what they're allowing is for covered services rendered by the behavioral health trainee to be billed under a supervising licensed clinician's NPI number, that's the national provider number. Two, they require to do this that the supervising contracted provider must be available 100% of the time to that behavioral health trainee who's providing services, which would enable the supervisor to provide direction and intervene in the event of emergency. Number three, the supervisors may supervise a maximum of 4 trainees at a time. They stipulate that the supervisee must receive the required minimum individual face-to-face supervision in compliance with Illinois state licensure requirements specific to the trainee's level of licensure. So they are deferring, as they should, to Illinois state law for those professions. And they stipulate that supervisors and supervisees should work within the same organization or system. They, state that they might waive this if there's programs that are reaching underserved populations. And they have a rule that the supervisee doesn't make a direct payment to the supervisor for supervision while they're pursuing their clinical hours for state licensure. So, here we've got Blue Cross Blue Shield of Illinois recognizing the importance of that supervisory relationship, the ethical and legal and consulting responsibility of that supervisor to the supervisee. So, there's more examples out there than this, but there's a lot of other ways that Blue Cross Blue Shield of Michigan could be handling this, and it's very telling that they are not. So let's look a bit at Michigan mental health provider shortages. Per the National Center for Health Workforce Analysis, that's the NCHWA I was mentioning earlier, in Michigan in 2026, we already are short 2,170 mental health counselors and 1,410 psychologists. That's just now. So we're already at a deficit right here, right now. And we have Blue Cross Blue Shield of Michigan saying that, 10,000 people who are eligible to be treatment providers in the state of Michigan, and many of them who are working in private practice settings are no longer going to be eligible to see Blue Cross Blue Shield of Michigan's PPO patients. So that's gonna make this number feel larger. And the projections for Michigan in 2036 is that we will have a shortage of 4,070 mental health counselors and 3,820 psychologists. Sadly, these folks didn't have Michigan specific data for social workers and marriage and family therapists. However, um, we are going to be seeing a shortage of those. So the challenge is if supervisors who are working in private practice settings aren't willing to take on supervisees, the entire pipeline of incoming counselors, social workers, marriage and family therapists, and psychologists just shuts down. If we look at NCHWA's numbers in terms of mental health care provider shortages across the entire US in 2038, you can see that we're going to be short almost 100,000 psychologists, 100,000 counselors, nearly 34,000 marriage couple and family therapists, and nearly 28,000 social workers. So we're already going into shortages. We currently have shortages. It's going to be pushed. They're predicting it's going to get even worse. But the problem is if that students don't see a pathway that they can get through their graduate school to be able to get internships sites and then be able to graduate and earn their hours while they can make some kind of a living until they can get independently licensed, these numbers are going to go up exponentially. So why did I say at the beginning that this is a breach of contract? If Blue Cross Blue Shield of Michigan, their PPO, if that's your plan, remember that you paid both more in premiums and deductibles so that you could access not having to coordinate everything through your primary care physician, not needing a referral to see a specialist, a greater number of providers, less structured care coordination, direct specialist access, and much higher overall flexibility to meet your healthcare needs. But what Blue Cross Blue Shield of Michigan PPO is now doing the same thing as their HMO with your mental health treatment providers. But the reality is you paid them for more access, not less. And that's where the breach of contract comes into play. All right, so the 6 things that you must do as a faculty member. 1 is to contact your Michigan House of Representatives member and complain that Blue Cross Blue Shield's PPO coverage is acting like HMO coverage. It's going to cause thousands of Michigan interns and limited licensed mental health providers to lose their clients and/or jobs. Let them know if you personally are under threat of losing your job due to low student enrollment, the panic that you might be hearing from students or what their concerns are right now. If clients are not going to be able to see you or your students, and the impact that'll have on everybody. You can find your representative's information at the link I've provided here. You can also find templates for how to write your letter and a whole host of other advocacy resources at my website. So let's kick over here. This is my Blue Cross Blue Shield of Michigan page, and I've got all kinds, everything's grouped by sections. So the first thing I have, because it's the biggest group, is advocacy resources for Michigan Blue Cross Blue Shield PPO subscribers. And there's a few things that if you happen to fall in that category that only the PPO subscribers can do. One of those is point number 3 down here, that you can write or call the Office of Consumer Services within the Michigan Department of Insurance and Financial Services, the DIFS. And I also have a link here about where you can go to file a complaint with them. The DIFS is the government agency in Michigan that allows Blue Cross Blue Shield of Michigan to even sell health insurance in the state of Michigan. So they have a lot of sway and power over Blue Cross and Blue Shield, so they can apply a lot of pressure, which is awesome. And then also Blue Cross Blue Shield policy members can complain directly to BCBSM. I've provided the mailing address for that and the fax. And on my video, I've got 2 videos for Michigan Blue Cross Blue Shield PPO subscribers to explain all of this and the resources for them. But underneath them, there's all the advocacy resources for Michigan limited licensed mental health professionals. Underneath them, all the resources for Michigan fully licensed mental health professionals and or private practice owners. And then we've got the advocacy resources for Michigan graduate mental health program students. So you may want to guide your students to this area to help them advocate. There's a YouTube video specific to them, and there's a 7-page and a 2-page document that outlines the content of what's in that video, and then all of their links and their downloadable resources. And finally, at the very, very end, because we're really the smallest pool, are all the resources for Michigan graduate mental health program faculty. Now, right now, because I'm recording this video, I can't list quite yet point 1, which will be the link to this video, as well as a 7-page sheet and a 2-page sheet about the details that are inside of this video. Those will be forthcoming by the time you're listening to this. Those will be there for you. But what I've talked about is that you need to write your Michigan representative, and you can download an RTF file. The file downloads are primarily, the text ones are RTF files, so that they can be opened on a Mac, a PC, but also by things like Google Sheets or Google Docs, I'm sorry, very, very easily. So you've got that. I also have a link here as to how you can find your Michigan representative. And that'll take you here to the Michigan House. And all you need to do is pop in your street address, city, and zip code, hit submit, and you will know who your representative is in the state of Michigan. But I've also provided an Excel file that contains the address, like the mailing address, also the exact office location, but the email and the phone number for all Michigan representatives. So if that's handy for you, it's there, it's ready to go for you. If you were to download this RTF file about contacting your Michigan representative, it would pull up this particular RTF file. The beginning in red, it's got some instructions, and then there's some text in green that might be points you want to consider as you draft what you want to say. Phone calls matter more than emails, but certainly you can do it all. You can email, you can call, and you can mail. Remember that living in the district of the legislator makes a bigger impact, which is why I'm starting you off with contacting your state representative. You're going to notice that the letters, and however you're contacting them, you want to begin by letting the person who's taking the phone call or reading what you're writing understands that you know the legislator, the leadership roles that they hold. And then, I know this can be difficult, you need to thank the legislator for 2 or 3 things if you can. If you can only find one thing, then just list one thing that you appreciate that they've done, or they've been up to, preferably fairly recently, that you appreciate. No one is going to love everything that their legislator has done or is doing. And we don't want to complain about other things. We're asking them to do something for us. And so now it's not the time to complain about other things. Save that for another day. I'm not saying you shouldn't contact them about things you wish they were doing instead, but that's for another day. You will notice that then asks for help with this. So definitely feel free to edit, but the format's really effective. So put your name, your credentials, your address, phone, and your email. It's especially handy for the legislators to know if you live in their district or not, and then they often will try to contact you. You know, a lot of times it could just be if you send an email, they'll just kind of have an automated email saying thanks for your email. But many of them will also contact you with a real reply. You want to date it. This example, I've just started off as if House Speaker Matt Hall is currently your representative. And so because he's House Speaker, I greet him as House Speaker Matt Hall. If your representative is just a representative, then just say, Dear Representative, and use their last name. So then I thank them for protecting the citizens of Michigan as a state representative and a Speaker of the House. And I have listed a few things here that I appreciate that this person has been working on. And, you know, if we go up to our legislators page, often in their recent posts, we can figure out what they've been working on. Sometimes it'll be on their About page. And then on this page is where you're going to find their contact information if you don't want to download it from that Excel file that I created for you. Certainly understandable if you don't want to do that. So then I begin as your constituent, and obviously you'll change this to whatever you're licensed to be and whatever program you are teaching in, that you're responsible for preparing Michigan's future mental health workforce and asking them that you hope they'll also agree to protect Michigan citizens by intervening to stop BCBSM's proposed PPO changes to Incident to billing in private practice settings. And obviously, you will talk about what you would like. You may want to talk about how this policy will severely damage the educational pipeline that prepares Michigan's future licensed mental health professionals, and that it goes beyond just our universities, that it's going to affect every Michigan resident. You know, reiterate what you're teaching in, and certainly talk about what you're responsible for training those folks to do, and the fact that private practices are providing a lot of our training opportunities and how much of an indispensable partner we find them to be. And the idea that they'll make it financially impossible for private practices to accept practicum students, interns, and graduates working towards independent licensure, and that the results will be immediate and devastating. The ways that graduate students can struggle, and, you know, the fact that it's not just about one of our licenses that it's at risk, it's all of our licenses. And it's a workforce development issue, and we've already got the shortages, and that their rationale doesn't justify the harm it will cause, and they've got other options. And there's so much years of training that our students have done, and dollars in tuition, and then developing all these competencies. So the idea that the policy is jeopardizing the promise that these students believed they were going to get, and how this also is going to severely impact the patients. So, and then after that, what's in black is more of the nuts and bolts of what's happening and why. Feel free to, as with every word on here, take out what you hate, add in what you think's more important. But it is helpful to add in details about what is happening and then signing off with your name and your credentials. So I do hope that this template can give you a jumping off point as you are reaching out to your Michigan state representative. So the second thing to do is the same thing with your Michigan senator. All of us have one Michigan senator. You can find your senator's information at the link I've listed here. I've also got information on my website. So you would use the same file, the RTF file, to begin this letter. And if you click on this link, it'll take you to the Michigan Senate main page, and you can just enter your address in the search bar here, and it'll tell you who your Michigan senator is. So I hope that'll help you move things forward in writing your senator. So the third thing to do is to contact the entire Michigan House Health Policy Committee. And you're going to complain about all the same things. So the good news is once you begin to write the one letter, it'll help you move through pretty quickly writing the rest of them. You can find the Michigan House Health Policy Committee information at the link I've provided to you. And there's templates and links on my webpage. So if we look at point 3 here, I've created an RTF file to get you started in writing the Michigan House Health Policy Committee. And if you click this link, it'll take you to where you can see who's actually on the committee. And so if you click that link, it'll show you here, these are all the members of the Michigan House Health Policy Committee. So what's so important about emailing these folks? They are responsible for ensuring that Michigan has the workforce to provide behavioral health treatment to Michiganders. So these folks care a lot about the fact that we could not only within just a few months lose many, many thousands of mental health treatment providers in the state of Michigan, but that we'd be closing significantly the pipeline for new graduates to be coming through and out of those programs. So they have a vested interest in this, and they need to be well aware. And because they have a vested interest in it, and this is their focus, then it helps because they will be more likely to apply pressure to Blue Cross Blue Shield of Michigan to change this policy. Now, it's a House committee, it's an important committee, so you can see there's a lot of members here. And if you're like, well, I'm not going to write or call all of these people, if you're only going to do a few, then I would say that you want to definitely send something to the chair, the majority vice chair, and the minority vice chair. And certainly if you click on these individuals, it takes you to their page so you can find out a bit more about them. So the RTF file that I've created for this, it's the same thought process. I've written this one directly to Michigan House Health Policy Committee Chair Vanderwall. And so I've specifically thanked him for chairing that committee. And I have found some things that personally speak to me about what he's been doing lately. But certainly you can visit his page and you can see what speaks to you. And then from here forward, there really won't be too much that you would say differently. There might be a little bit, but than you did in your previous writing to your personal representative and your personal senator. But it's important to read these committee members in on what's happening as well. I hope that this will be helpful to you as you move forward. So the fourth thing to do is to contact the entire Michigan Senate Finance, Insurance, and Consumer Protection Committee, the FICPC. You're going to complain about all the same things. You can find who's on that committee at this link. It's quite a long one. You can find that link on my website as well. So why do we want to complain to the Michigan Senate Finance, Insurance, and Consumer Protection Committee? Well, these folks are the ones who are in control of the department, the DIFS, that I had talked about prior, that manages and allows Blue Cross Blue Shield of Michigan to even sell health insurance inside of the state of Michigan. So, they're the boss of that department. So, they have a lot of pull and a lot of sway. And that makes our crisis important to them and a focus of the committee that they are running. So you can see here under point 4, I have an RTF file template. And then right below that, I have the link that'll take you here to show you the Senate Finance, Insurance, and Consumer Protection Committee. And you can see, we have far fewer senators. And so there are fewer members of this committee. I would encourage you, just like with that House Health Policy Committee, that you contact everybody here. But again, if you don't feel like you're able to do that, if there's only 3 people that you contact, then it should be the chair, the majority vice chair, and the minority vice chair. And certainly our chair here is Chair Kavanaugh. If you click on her link, then you can be taken to her page. So when it's a similar format, I'm greeting her as the chair of the committee. I thank her for protecting the citizens of Michigan by chairing that committee. And I have found a few things that I feel are great things that she's done inside of the state of Michigan. Obviously, feel free to amend that to whatever speaks to you. And then you'll read her in on the issues that you're seeing from your perspective. So I hope that'll help you craft that letter quickly, or I should say those letters quickly. So the 5th thing that we'll want to do is to contact Governor Gretchen Whitmer and complain about all these things. So you can find her contact portal at the link provided here, but on my website, I've got that link for you. And if you click on it, it'll take you to this page. And then also an RTF template for contacting the governor. And no surprise here, it all pretty much begins the same. I just thank her for protecting the citizens of Michigan as governor. I've found some things that I've appreciated that she's done. And then my letter goes on from there. So, so I do hope that these tools will be helpful to you as you write and contact the governor. She, this matters to her because she knows that there's already too few mental health treatment providers in the state, and it's also a workforce development issue, which she cares about as governor. So this is certainly, this hits on a couple of fronts in terms of things that matter to her. And lastly, we want to take to social media outlets and complain about these things. We just need to complain in a way that you protect your personal information about you, your clients, and your students. So we just want to be thoughtful about what we're sharing in a way that, especially for students and clients, protects confidentiality. And then we need to think about, what do we feel comfortable sharing and disclosing about our own situation? But certainly, the more noise that we make, the more people that know, the more pressure that Blue Cross Blue Shield of Michigan will have on them to amend this policy. They do not have to do this in this way and cause such devastating consequences. So thanks for tuning in. I hope that all those various resources that I've provided will be helpful to you, and feel free to share these resources with Michigan Blue Cross Blue Shield PPO subscribers, students, other faculty members, limited licensed clinicians, fully licensed clinicians, private practice owners. We can do this. And certainly, if we all pull together, we can have a much better outcome for ourselves and our students and the citizens in the state of Michigan. So thanks so much for listening. I hope this has been helpful. Have a great day.